CET, Communication and Educational Technology, Unit 2, Interpersonal Relations. This is the second unit of Communication and Educational Technology, Interpersonal Relation. That is the relationship between the two persons. Okay, in the medical field, especially in the nursing field, the two persons are nurse and patient. What is the relationship between the nurse and patient? Okay, the content. The contents are contents in the interpersonal relations. First, meaning, introduction, meaning and definition, purpose and types, and phases. Phases means stages. Stages of IPR, mean interpersonal relation, and barriers and methods of overcoming the barriers, obstruction, and Johari window. Johari window. Yes. Okay, these are all the contents in the unit to second unit, interpersonal relations, in the subject of communication and educational technology, second year B.Sc nursing. Today is the introduction class. Okay, today is only the introduction class and the meaning. Okay, let us know what are the introduction. See, this is today class. Okay, introduction, definition, and components, and finally there is the types. Okay, introduction, definition, components, types. Okay, today we are discussing about these four main topics. First one, introduction. Okay, introduction. The communication is a powerful way of conveying the message or conveying the someone's feeling and opinion. Okay, from the beginning of communication education technology unit 1 till the finishing of complete unit, I only start with the communication because the subject it is called CET, Communication Education Technology. Okay, that's why in every unit this communication is very important. That's why I'm starting giving a introduction about the communication. Okay, communication is very powerful material. Okay, powerful way. Okay, powerful route. Okay, route that conveying the feelings. Okay, conveying the feelings and opinions. Okay, feelings and opinions of person. Here that person is called patient. Okay, patient. This chapter is completely depending on the patient nurse patient relationship, NPR. NPR, nurse patient relationship, or NCR, nurse client relationship. Okay, see, this type of relationship is based on trust, respect, empathy, professional intimacy, and appropriate use of power inherent in the care of provider's role. Care provider's role. Who is the care provider? Yes, exactly. That's care provider is the nurse. Who providing the care? Okay, who is the main? Who is the main role? Okay, main role in providing the patient care by the different types of nursing care. Okay. Next, definition. Definition of IPR, interpersonal relationship. In the view of Hildegard Peplau, nursing should be considered a significant therapeutic interpersonal process. Nursing. Okay, in the view of, okay, she's one of the scientists, or she's one of the philosopher, Hildegard Peplau, nursing. Okay, according to her, nursing should be considered a significant and therapeutic interpersonal process. According to her, she defined that process, interpersonal relationship process, as a human relationship between the individual who is sick, that means patient. This is 2 marks question. Define IPR anta they may ask. Human relationship between the individual who is sick, mean patient, or need of health services. Okay, it's the difference or relationship, human relationship between the patient and the nurse. Okay, that is human relationship between the individual who is sick or who is need of health service and a nurse, specially educated to recognize the problem and respond to the patient need or respond to the need for help. This is the meaning of this definition. This is 2 marks question. Next class I will ask the definition of this IPR. Okay, see the interpersonal relationship, it is defined as, according to Hildegard Peplau, according to her, the human interpersonal relationship is defined as the human relationship between an individual who is sick or in need of health service and relationship between the individual who is sick, need of health service, and a nurse, specially educated to recognize. Specially educated means nursing students. Specially educated, they will successfully completing the degree B.Sc nursing educated, and GNM general nurse and midwifery, and also MSc nursing and PhD. See, these are all the specialized educated nurse. Specialized educated nurse without any education, we call it she's doing the nurse duty means yeah. Okay, in educated person, special educated person, they or she or he, the nurse, they know everything. What's the complete procedure of oral care? We call it as, the type of nurse we call it as specially educated nurse. To recognize the problem is have to able to recognize, identify the problem. Assessment, nursing assessment, have to assess the patient and has to respond to the need for help. Assessment, have to respond to the patient and have to assess the patient and to respond based on goal, have to put some goal outcome. Okay, outcome and put the intervention, gradual implementation. These are all the nursing special educated nurses work. Okay, this is the definition of IPR, interpersonal relation. Next, components. Yes, components. Components are some of the components are some of the parts or some of the points. Okay, for example, components means some example taking a laptop. For example, taking a laptop, the laptop, the keypad is one of the component of the laptop, and the screen of desktop, like that is the components. Okay, like there is a 5 components, there is 5 main components to the nurse client relationship. And see her: trust, respect, professional intimacy, empathy, and power. In the introduction only I introduced these 5 words. Now, first one, trust. Okay, trust, it has to establish it in the nurse-patient relationship, NPR, by keeping promise and maintaining confidentiality. Okay, by maintaining some confidential, some secrets. Okay, the patient is not at all telling any. Okay, not at all telling their personal things. Not to, they will not share. Patient will not share their personal things with the neighbors or with the family members. Okay, the nurse easily, the nurse handle that type of patient and collect the information. Okay, nurse collect the information that is based on trust. Nambike, trust. Okay, you already know the meaning of general term of the trust. Okay, that is the promise. Promise and the maintaining some secretness. Okay, secretness and confidentiality. Belief. Okay, belief. The patient is believe in the nurse, faith, confidence. Okay, believe in the patient's or nurse truth. Like that is the trust. First component. Before starting your nurse-patient relationship, these are of the main 5 components. This is work as a 5 main components. Trust. Next, respect. Okay, it would be not only nurse-client relationship. In any relationships, any interpersonal relationship, any between the two-person relationship, you want respect, self-respect. Okay, self-respect like that. In the coming to the nursing field, there is the nurse-patient relationship. You have to give respect and take respect. Okay, in the nursing field, respect is one of the important component. Okay, respect is the recognition of the inherent dignity. That's maintain some dignity in front of the patient and give the respect also. Okay, give the respect also to the patient and also receive the respect. Not okay, not talking rudely. You can talk smoothly and give the respect. Any patient you call it as sir, madam, or Mr. XYZ or Sir XYZ, like that. You have to call the patient by name. Hey, come here. What is up? Not like that. Not like that. Don't call it as a singular word. You have to call it as plural and by name. Call by name. And uniqueness of every individual regardless of socioeconomic status. Okay, and personal attitude and nature of the problem. Okay, nature of the problem. If some of the patients is having some itching problem, okay, itching, pruritus, itching problem, or redness of skin, some itching problem, you after the patient is confirmed any itching problem, okay, scabs like that, there is some problem, you don't laugh in front of the patient. In front of the patient is having any itching, any problem, don't laugh, don't laugh, don't smile. Okay, understand the patient problem. This is one type of the nature of the problem. Or socioeconomic status. I okay, high class people or low class people or middle class, low socioeconomic status, you giving the respect, you have to give the equal respect to all the person. Okay, don't look the money in the patient, don't look the money, look the patient health problem. You are the nurses, you have to only focus on the patient problems, not patient status and not patient gender and not patient problem side. Any problem in the private area, you look and don't laugh. And itching in the groin region, the patient is continually itching means understand the patient problem, don't laugh and don't smile to the patient. Okay, see, this is the second component. Before you starting the communication or relationship or starting the relationship with the patient, this is the five main points. You have to maintain trust in the patient, you have to give the respect to the patient. Next, professional intimacy. Third one, professional intimacy. This is the service that nurses provide. Type of care, professional intimacy. Okay, professional work. Okay, you are the nurse. Okay, you are the educated nurse. Okay, I am studied B.Sc nursing fourth year. Very good, first class marks. Okay, you have to know the basic nursing care. How to give the nail care, how to give the head bath, how to give the bed bath, how to give the sponge bath. Like that, you have to know the basic nursing care. That is professional intimacy. You have to relate your theory work to the practical, correlate that one, and it may relate to your physical activities of carrying out the nursing procedure, or it may also involve the psychological, spiritual, social elements that are identified in the plan of care. Okay, when you starting the planning the intervention or you start writing the intervention, you have to plan the what are all the things you have to cover, including psychological, including spiritual, and including social element. For example, the patient having any headache, any problem, pain abdomen, patient problem is pain abdomen, you have to consider the patient psychological status. Patient may anxiety. Okay, patient may anxiety, there is first time in the hospital hospital admission, hospitalization first time, you have to cool the patient, provide psychological support to relieve the anxiety. Okay, this is the first intervention. And assess the patient, second one, and reassure the patient to relieve the anxiety. These are all the interventions. These are the intervention and also ration and spiritual. Some of the patient, um, they believe in the God. In Christians, they believe in the Jesus. In they believe in the Hindus, God, and Muslim they believe in the Allah. Like that, they maintain some spiritual confidence. I pray now. I pray. I will be cured. Like that. Don't neglect that type of spiritual care. You have to include that one also. pray for headache, like that. Pray for the patient to relieve the headache, like that. You have to create some intervention that may lead, that may get from positive marks from the patient also, and that will also improve your relationship in IPR. See, that nurse is that nurse is understand my, the patient is think that, okay, that type that nurse is understand my spiritual spirit, like that. And you have to mention some social elements. Okay, see, this is professional intimacy. You have to work based on your nursing procedures and based on your nursing care. You have to know theory and also practical also. Okay, that is professional intimacy. Next, empathy. Empathy is the expression of understanding, validating, resonating with the meaning that holds for the client. Okay, empathy. You know what is difference between the empathy and sympathy? Empathy and sympathy. These are the basic terms. Empathy. Okay, ability to understand and share the feelings of another. Okay, ability to understand and share the feelings of another. That is empathy. Okay, that is empathy. Ability to understand. Ability to understand. That is the empathy. Okay, sympathy is the feeling, soft hearted. This is empathy is only the expression that person is fall down from the cot. Oh, that is, this is like empathy. Okay, this is like empathy. This is the empathy. Next, sympathy. Sympathy is showing the soft hearted. You go and help to the patient. Okay, it is empathy. You have to maintain some empathetic service. You have to give some empathetic service. Empathy is the expression of understanding, understanding the patient problem. Okay, you have to maintain only empathy. Sympathy secondary. You have to first maintain the empathy. You maintain sympathy in the social relations or in the society. In the hospital, you maintain empathy. The patient having pain abdomen. You don't act like you are having a pain abdomen. That is sympathy. You don't act like, oh, patient is having pain abdomen, I'm showing the sympathy. I have also pain abdomen, I will take it. Now I want to take the rest. I have pain abdomen. Not like that. That is sympathy. Okay, patient is having pain abdomen, I am showing the sympathy to the patient, and now I am also pain abdomen. I'm not ready to for working, like that. That is sympathy. You start empathy, that is understanding or expressing. Patient is complaining pain abdomen. Oh, pain abdomen. Okay, cool. We are here. No problem. You're telling to the patient, oh, we are here. No problem. We'll give the injection. No need to worry. Okay, so we will give the cyclopharm 2 ml to the intramuscular injection. That you are that definitely relieve your pain abdomen. Don't worry. Like that, you have to show your empathy to the patient. Okay, sympathy is different, empathy is different. Empathy is the expression of understanding, sympathy is the acting. Sympathy is the, that the patient is having pain abdomen, you are also showing the sympathetic sympathy. I am also pain abdomen, like that. Okay, next, power inequality exists between the nurse and patient in the nurse patient relationship. Okay, power, any work, any doing any work, you have to show the power. Next, types. Okay, types of IPR, types of interpersonal relationship. First one, friendship, family relationship, romantic relationship. Okay, what is friendship? Relationship between the two person without any expectation. Okay, see, this is the friendship. This is the first type of interpersonal relationship, IPR, friendship. I think you already know, the students already know the about friendship. That's relationship between the two person. It may be man or woman, it may be girl or boy, it may baby child or baby boy, like that. Anyone, grandmother or grandson, anything. That is friendship is there, not without any expectation. It's the pure relationship. After that, it will converting in the love. That is secondary. Friendship is the pure relationship between the girl and boy, or any boy and boy, any persons, two persons, without any expectation. And family relationship, this all already know, that is family relationship. Brother, sister, father, mother, uncle, auntie, grandmother, grandpa, like that. That's related by the blood relationship. And romantic relationship. Okay, romantic relationship. It's the intimate relationship of getting deeply attached to each other. It's, for example, now youth are doing like that. That is the love. That is romantic relationship. Romantic pure relationship. Okay, it's intimate to relationship of getting deeply attached to each other. Okay, see, these are all the relationship. There are 5 relationships. 7. Okay, friendship, family, romantic, professional relationship, marriage, platonic. Okay, acquaintance. Now we'll tell this is the types of interpersonal relation. Next, professional relationship. Individual working for the same organization. Now we are lecture to lecture relationship, or lecture to principal relationship, or said to be share a professional relationship. Okay, that is the professional relationship. Lecture and librarian relationship. It's a pure. And marriage. Okay, husband and wife. You already know the marriage. No need to explain. And platonic. Platonic relationship. It's the relationship between the two individuals without feelings of sexual desire for each other. Without feelings of sexual desire. Okay, without feeling of sexual desire. Okay, and that's the platonic, without feelings of sexual, okay, sexual wish or sexual desire. Okay, hope. Sexual wish, desire means strong feeling, wanting feeling, happening feeling. Okay, something, or greed or want, without feeling the sexual want. Okay, for each other, in men or women. I already told this relationship is not dependent only men to men, women to women. It's all from the child to an infant, 1 year infant, to the till the death. It's all type of relationship. It's the platonic. And acquaintances relationship. It is the where someone is simply known to someone by introduction or by few interaction. Or in the, this is the bus stand relationship. Okay, you're waiting for the bus stand. Someone is come. Within the few seconds, you can talk. It's simply know to someone. You can toss a bus. When is the bus? When is the next bus? Sir? Like that, they will start the conversation or communication relationship. Okay, see, this is the friendship, family, romantic, professional, marriage, platonic, acquaintances. These are the 7 main interpersonal relations types: friendship, family, romantic, professional. The interpersonal relation, the NPR, it is comes under the professional. Okay, professional relationship. Okay, nurse patient also comes under this type of relationship. Any doubts? If you have any doubts, if you have any doubts in these contents, that I mean meaning, definition, components, what are the components you want to, what are the components of interpersonal relationship, and types of interpersonal relationship. These are the main today's topic: introduction, meaning, definition, components, and types of interpersonal relationship. Okay, if you have any doubt, please put your doubts or questions in the comment box, in the chat box. Okay, thank you.